episode of Politically Street. I'm your community ambassador, Mr. Robin J. Anderson. Let me get my disclaimer first. Politically Street is not a politically endorsing podcast. We're only here for information purposes only. And we're here to spotlight people doing outstanding things in our community, business owners, and elected officials. So with that being said, I have a person I've been knowing for a long time, Ms. Natalie Anderson on it. So Ms. Natalie, what I do is I try to get a background of everybody, know where they're from and this and that. We kind of go into what it is that you do. Mm-hmm. So tell me, where you from? Where'd you grow up?
I am born and raised in Acres Homes, Texas.
Okay, shout out to the Fofo.
I went to Booker T. Washington High School. Okay. I graduated from Prairie View A&M. PV, you know. With my BSN, and then I got my MSN from Walden University online.
Gotcha, Walden. Okay, gotcha. So, it sounds like you said a BN, so what exactly is that BSN? What is that?
I'm sorry, Bachelor of Science of Nursing. So okay. I've been a registered nurse since 2010.
Wow. And
I've been a practicing nurse practitioner since 2019.
Wow, so you got a pretty good background in nursing and whatnot. Prairie View is pretty much known for its nursing program, if I'm not mistaken.
The best in the world.
Good deal.
You know, Prairie View produces productive people.
That's right. Mm-hmm. I tell people all the time, they don't believe me, you know what I mean? So we're here because of that. Yeah. So you say, so you've been in the nursing field for the last, say, how many years?
Decade, 11 years.
Wow, okay, guys. So how's it been treating you?
I love nursing. Mm-hmm. I will tell anybody to diversify yourself. Mm-hmm. Don't stay in one area. Mm-hmm. Basically, that's what I'm doing now as a practitioner. Mm-hmm. However, as in nursing, I stayed within my women, infant, and children's area. Mm-hmm. That was my passion. When I went to get my master's, I did family nurse practitioning, just because it was a wide umbrella and I could go to different areas.
Gotcha.
So I love family, mm-hmm. but I also have a passion for aesthetics, mm-hmm. and that is my current business venture. Mm-hmm. I've been doing aesthetics with my new business as an entrepreneur for about a year now. Mm-hmm. And I chose that business. One, I'm a perfectionist. Mm-hmm. Two, working as a nurse, long hours, having bags under the eyes, dark circles, just, normal occurrences with people who work long hours overnight. I've never worked overnight, but some people work from 7 p.m. to 7 a.m. And, our job is very demanding, mm-hmm. and sometimes it reflects.
Gotcha. But before we jump into the aesthetics, I want to kind of talk about, what you've experienced over the last year, going to this year as far as 2020, with the whole COVID thing and whatnot. So how did you feel when you heard about what was going on? And I'm pretty sure it affected, how you conduct yourself with patients and things like that. So first, when did you know it was serious?
So, with me, there was always a sense of urgency. Number one, because we had no information. Mm-hmm. There was a lack of information. The CDC didn't really have information for us. There were no really set guidelines on how we were supposed to protect ourselves and then also treat. And then in my profession, with pregnant women, we have to keep in mind the mother's health and then also the baby's health.
Right, check, okay.
So we were just improvising, to be honest. Mm-hmm. Every day our policies and guidelines changed. It was stressful. It was a little bit chaotic. When I say the nurses and the hospitals were hit hard, I think we probably were hit hardest during the pandemic, of course. Mm-hmm. It was difficult having a sense of fear of contracting mm-hmm. the virus and then having a sense of duty to care for the mother and then the child. And it was a little difficult because at one point we were separating the mother and baby. Mm-hmm. We were separating the father from mm-hmm. mom and baby. At one point, no one could be in the room. At one point, only one person could be there during delivery, but then the father couldn't see mom or baby after until discharge. It was very chaotic the whole way through.
I can imagine.
Yeah.
Wow. So how you got, so I'm pretty sure the whole delivery process was different. Like, so, yeah, how did y'all, I mean, I'm trying to get a sense of how you just, you take the child from mom. Did y'all test the babies for COVID too, or another only?
Yeah. Mom would come in. Initially, we weren't testing, which was a big, that wasn't the best method, which we learned quickly because we then implemented screening in the clinic, meaning they got screened prior to coming to delivery.
Right.
And we were finding that a lot of our pregnant mothers were actually positive for COVID. It was a very high number. So then once we started seeing that, it was like, okay, so we had to implement precautions for ourselves, meaning we had to don gloves, we had to don gowns, PPE, mask, N95 before we went into the room to even assess mom or ask her questions after admission. And we did take the baby immediately if they were positive. Because at that time we weren't sure about transmission from mom to baby.
Right.
Could they do skin to skin? Could they breastfeed? We had no knowledge of whether it was okay or not. So we were separating families for a while. Immediately, mom didn't see baby, dad didn't see baby, and sometimes, like I said, dad didn't even see mom.
That's almost like a form of trauma almost when you think about it. It's like, man, I can even imagine. Wow.
It was traumatic. We had a lot of moms that were okay because they didn't want their babies to get sick, and then we had moms that were traumatized because it's their first birth. They have COVID, so they're afraid of that, and then immediately their babies are just whisked away.
Right.
And they can't see them. However, eventually, of course, trial and error, we got iPads where moms could video the babies in the nursery, and the nurse taking care of the baby would allow mom to watch the baby or see the baby or, kind of interact. And then eventually, they came up with mom and baby can stay in the room.
Okay, gotcha. Okay,
So
wow.
about 6 months later, we were like, okay, this mom and baby can stay together. So we stopped separating families, and then we just kind of had it where dad could be there in the delivery room, but when they transferred, then there was a separation. But at least he had about a good 6 to 8 hours with the family.
Okay, gotcha. So from last year, what did you take into this year that pretty much like kind of put you in a mindset of being more entrepreneur minded?
That life can be unpredictable. If you have your heart or mind set on doing something, there is no better time than the present time because you just never know what's going to happen. We never knew we were going to be in a pandemic for over a year because COVID is still here. We've just adjusted to it, but it's still very present and it's still affecting us, but we are very resilient people, and
yes, we are. That's for sure.
We have accommodated ourselves, so it's just like I just felt like, you know what, it's no better time than the present time. This has been something that I've wanted to do, kind of been afraid to do, but going through a pandemic like that, you kind of lose fear. Especially when you make it through it, or you make it through all the changes, it kind of gives you more courage to do the things that you never thought you were capable of, or not capable of, but were slow to do or slow to try.
I got you. We talked about 2020 and what you took from 2020 going to, like you said, basically what did you take from as far as like, getting started with business? Like you never know what can happen, you know what I mean? And so why did you pick this profession as being an esthetician?
So, like I said, with just working in the nursing field for over a decade, working long hours, not being able to properly care for myself, not having time to do self-care for myself because the pull from the job, the pull from family, the pull from children, the pull from furthering your education. As a nurse in the medical field, you don't have a lot of time for self-care. You really don't. Most days when you're off, you may recuperate the first day, meaning you may just sleep. And then the next day that you have free, you're running errands that you need to get taken care of, and then you're back to the grind. And so a lot of nurses really don't take very good care of themselves. Some of the best nurses don't take care of themselves.
It makes sense because you're so dedicated to what you're doing, you know, so wow, it makes sense. But yeah, you definitely have to have self-care, self-preservation, because if not, you're not going to be any good to anybody else.
Exactly.
You know, so I will say, I didn't know that this profession had a lane for us. You know what I mean? You say black don't crack, but we got to preserve it, you know what I mean? Yes. And so how did you get into it? I mean, I don't want to get too personal, like if you take it yourself or whatnot, but you know.
I actually haven't had any injections done, but I am very keen on, I get facials twice a month. Every 2 weeks, I go in, I get a facial. It just revives me. It just gives me a little bit of a pick-me-up. And believe it or not, quality of life is connected to appearance. If you look tired, it's gonna make you feel tired. It's like a reflection in the mirror. You know, if you look tired, you're not able to comb your hair, keep your hair up. If your skin, you're getting darkness around your eyes from lack of sleep, or dryness in the skin, dryness in the lips, wrinkles, things like that, because you're not hydrating. We sometimes don't get lunches at work. If we get off late, we're probably too tired to prepare a dinner. We may bring a gallon of water to work to finish that day and not take a sip because of the hustle and bustle of the everyday nursing job. So I've always had interest in aesthetics, and I've always felt like it wasn't reflective of our culture. We're not very well represented in the aesthetics world. We can go get aesthetics, but it's not many practitioners that look like us, you know. So it's always important to be inclusive and to be represented, especially in healthcare. Whether it's your OB, your pediatric, your PCP, your aesthetics doctor you should also have choices, you know. And so I just noticed that it wasn't a lot of us. I'm very into keeping your skin. I've always been into keeping my skin together since I was a kid.
I can tell.
I would Vaseline. my grandmother had me Vaselining every night. I'm gonna be moisturized. I would cocoa butter if I had any scar or anything like that. So I've always been keen on skin care. So I guess it's always been something that's been important to me. But I just want to be able to educate our culture, our ethnic group, that we can do it too. You know, you can preserve yourself. Just because black doesn't crack doesn't mean you can't go get a wrinkle treatment, or, you know, a crow's feet treatment where you're not having the wrinkles around your eyes just because you've been working hard. It's okay to have self-care. It's okay to preserve your appearance so that your quality of life is good. After you're retired and you've worked all these long, hard years, you want to look good.
I agree.
You know?
I agree. I had a mutual friend that, and I didn't really notice it because I'm a guy, you know what I mean? But when I smile, I have, you know, crow's feet. I'm getting old. It is what it is. But now I think I may have to go.
I'm here for you. Men, it's Botox for men. A lot of men get it. Like you said, LL Cool J.
Right. 2
decades ago. Do you see LL Cool J at 60? He looks like he's 40.
Yeah, you can't tell, man. So, but I don't like needles though, Natalie.
Oh.
I know that sounds crazy. I got tattoos, but it's different being injected into your face. You know what I mean? So I don't know.
But surprisingly, when I tell you it is minimal pain, it's minimal pain.
We were talking about LL. You say how he looks. I didn't know he was 60.
You know, 50, 60.
He might be late 50s for sure.
Yeah.
You know what I
Well,
mean?
he's not 60, but I was just saying he looks 30, 40, to be honest.
Yeah, but he has the resources to do what he's doing, you know what I mean? So, but a person that has anxiety about needles, what would you suggest? Besides cucumbers on the eye or something.
The thing about that is, like, the face is a very sensitive part of your body, so you know it's sensitive to a lot more touch and pain than other parts. However, Botox injections use the same needle that you get TB testing with, or that you would use for insulin shots. So if you've ever been able to tolerate a TB test, or if you've ever received an insulin shot or any medication with an insulin needle, you can tolerate Botox.
I don't know.
It's such a quick procedure. Before you could feel the pain, it's over. It's what would I say? Like a quick sting, like an alcohol sting. Not even alcohol, because that's more of a burning sensation, but like a quick sting and it's over. Sometimes you don't feel it. So I would say you just have to try it to know.
I think I'm gonna hold on to my crow's feet and just drink more water and do some facial exercise or something, man. Cause some, I don't know.
You can try facials. I mean, you don't have to get as invasive as Botox. The reason why I do the aesthetic injections is because it's a long coverage period. So if you can be covered from 3 to 5 months, maybe even 6 months, depending on how good your skin is, but that's a good amount of time where you don't have to consistently worry about going back to get something done. You can do it every 3 months, or you can do it twice a year. So that's, you know, that's minimal care. Like, you don't have to put too much into it, so it's easier to maintain versus going every 2 weeks, because sometimes scheduling is an issue, or, you know, like for me, I just make sure I go, but it can be a hassle. Daycare, your day off, you have errands to run, you may have doctor's appointments or other things you're trying to take care of. I just decided to just take time out to just care for myself, and so I just feel like this is a good avenue for me to educate more of us that yes, it's not only for other cultures to preserve themselves, even though, you know, we are blessed with our genetic DNA and our melanin, of course, but we can still preserve our beauty.
I agree. So we were talking about, you know, how you start the business. Now he said how important a business plan is, and knowing when to execute and things like that.
Yes.
So
yes, you have to have structure. To me, getting a business plan done and being involved in the business plan was the best teaching tool that I could have had, because it breaks it down from beginning to end. It helps you focus on areas of weakness. It helps you know areas that you're strong in, and it brings everything together to make your business structure foundation strong, because you're hitting everything. You know, you're gonna know about marketing, you're gonna know about sales, profit, doing analysis of your other businesses in the same arena as you, and it just helps you go at a steady pace versus just jumping into it, skipping a lot of the things that you need to do before you should actually start. And it just makes the transition easier. Even though it's taken me over a year to actually start, when I started, everything was in place. So it wasn't a lot of trial and error. It's always going to be some, but it wasn't a lot. You don't have to learn everything the hard way. You can sometimes just do it in a process, step by step.
I agree. Sometimes you have to go through those steps, because like if you're at 1 and you jump all the way to 7, you're trying to get to 10, those little small ones in between can cost you a whole lot of
and make you go from 7 all the way back to 1.
Gotcha. So where can people find you?
So you can find me on Instagram at pure_health360. You can also find me on the web at purehealth360.com. I will be also launching a Facebook page here soon. Also, I would like to shout out 2 other entrepreneurs that are also in the medical field. Brightstone Psychiatry is a very close friend of mine. She just opened her psychiatric clinic about 4 months ago. and black owned, and also Space City Urgent Care,
Okay.
board certified practitioners, affordable, no insurance needed, $50 visits, and it's called Space City Urgent Care on Instagram, and also spacecityurgentcare.com. All black owned and entrepreneurs.
I love it. I love it. All right. So y'all make sure and go follow Ms. Natalie on Instagram or all her social media platforms.
I want to say something.
My camera person wants to say something. Come on around so they can see.
Make sure to like and subscribe.
Okay, so also y'all make sure and go to my Instagram page, my Facebook page, Political Street, subscribe to YouTube, and go to politicalstreet.org and get your t-shirts, and I appreciate all the support everybody's been giving me so far. So that being said, I'll see y'all next time. Peace.